Well, hello everyone. Today, Resource Team will be giving a presentation on social anxiety disorder, and this is another disorder that's actually part of our mental health spotlight series. For the new pups joining us today, some of the disorders we have covered already in this series include obsessive compulsive disorder, bipolar disorder, as well as autism and autism spectrum disorder. So be sure to check those out, the slides in the videos. And diving right in, what is social anxiety disorder? Before we talk about the DSM 5 definition, what can you all tell me about what you do know about this disorder? What are some common characteristics that might distinguish it from a generalized anxiety disorder? And you can also think about how it's portrayed, what you've read about it, or maybe seen in our media. So I'll give you some time to think. Let's aim for maybe 3 to 4 responses before we move on here. Isabel says, when being in social situations creates anxiety. Yep, pretty much. It's like right in the name, right? Definitely. That's really the founding characteristic of this disorder. Misty says, it's an intense fear of how you're perceived by others. I really like that you said that, Misty. We'll talk about some of those characteristics of being perceived, being evaluated, how people feel that they're being perceived in like social and performative situations. So, absolutely, that's correct. Isabel says, small tasks like ordering a coffee become harder when it requires you to interact with other people. Yes, I'm really happy that you brought that up too, Isabel, because we talk about this too. How little things that might feel so normal to us, ordering a cup of coffee. I use an example later in this presentation, like using a public restroom. Those things that may be okay with us and require no extra thought or intention to do so is really hard for people who struggle with social anxiety disorder. I think we got a lot of good feedback. I think it's safe to move on now, but if you guys think of anything else, feel free to drop it in the chat. So you all brought up some really great points, and I always like these discussion questions at the beginning because I think they're a good starting point. A lot of what you've already been exposed to about social anxiety disorder will show up in this presentation, either when we're talking about the characteristics or also common misconceptions and stigma. So we've listed here some of the diagnostic criteria for social anxiety disorder per the DSM-5, and these include characteristics like a persistent, intense fear or anxiety about certain social situations or performance situations, and by persistent, we mean lasting 6 or more months in length. And whatever situation is being feared, exposure to this situation almost invariably provokes anxiety and can lead to the individual experiencing panic attacks. Another component that is important to note is not only are these anxieties and fears present, the individual will also go out of their way to avoid these anxiety producing social situations. And if they have to, they do endure them, but with an intense fear, anxiety, and distress. And this anxiety, the distress, and the avoidance behaviors they may exhibit must interfere with their day to day. Lastly, the fear and anxiety must not be better explained by another medical condition, substance use, or any other medication the patient is taking. The prevalence for social anxiety disorder, according to the American Psychiatric Association, is 7% in both US children and adults, and some data collected by Harvard Medical School in 2007, which actually at the time was based off of diagnostic criteria for the DSM-4, showed a difference in the 12-month prevalence, which was around 7.1%, versus the lifetime prevalence, which was around 12.1%. And I think this is a good point to make. That's a 5% difference. And when I personally came across this data, it did make me think about I don't know, maybe it's almost been like 2 years now that we've been living through this pandemic, and the time that we've spent isolating and quarantining and socially distancing, what that has done to our current data. And I couldn't really find any good studies on it, probably because we're still really in the thick of it. But I do encourage you all to think about this too. If the 12-month prevalence may be higher now, um, what about the lifetime prevalence? That could also be higher, seeing that this is something that's really affected everyone across all generations. So, yeah, just some food for thought there. Okay, so that was a really quick overview of social anxiety disorder. Let's talk about some more specific characteristics. Some physical symptoms we may be familiar with include blushing, increased heart rate, trembling, and sweating. And I think those symptoms are usually associated with being nervous, being anxious, shy, or embarrassed, which is often something people can dismiss social anxiety to be. But the individual may also experience symptoms of nausea, trouble breathing, feeling dizzy or lightheaded, feeling that their mind has gone completely blank, even muscle tension. And some emotional and behavioral symptoms may include an intense fear of interacting with people, especially strangers, and an avoidance of different situations. Like we'd mentioned before, these could be social or performative. And one thing I thought was important to include is that fear of a performance. Let's say they must speak in front of a group of people or have to collaborate with others at work. The individual may analyze their performance and their behaviors after the situation has occurred and really trying to identify the flaws present in their interactions. And honestly, I feel like most of us may have done this at some point in our lives. Like, we think back about a conversation we had and we're like, man, I should have said this, or I shouldn't have said this. But this is different. It can be after every social or performative situation that the person is looking back to evaluate and even critique themselves on all the little interactions that they had harbored so much fear for. And lastly, another behavioral symptom is just expecting the worst possible outcome of a social situation. Not just thinking about all the ways that something can go wrong, but really believing that if they endure these feared social situations, that the worst possible outcome will occur. And we've talked a lot about avoidance, but here's some common situations and examples of things that an individual with social anxiety disorder may avoid. So they may avoid interacting with new people, attending social gatherings, going to work or school, making eye contact with others, and even the things we don't think about. I really like, again, that example that Isabel had brought up. She had mentioned getting a cup of coffee, things like returning items to a store, eating in front of others, using a restroom in public. Everything that might be so normalized to a lot of us, and I guess you could say easy, uh, are really difficult for people who live with social anxiety disorder. And some consequences of social anxiety disorder can include low self esteem, having trouble with being assertive, hypersensitivity to criticism. And here, think again about how an individual with social anxiety disorder, they may analyze their performance and their flaws in social interactions, how they could always be subjecting themselves to self-critique. The individuals, they may also choose to socially isolate. They may have difficulty with their social relationships. And there's also been an association with other mental health disorders too. There's an increased risk of both substance use disorder and depression for those with social anxiety disorder. And these disorders do co occur for a percentage of people. And with that, I'm going to hand off to Zoe. She'll talk more about the different types of social anxiety disorder.
There are two types of social anxiety disorder. These are really broad, but um, what most of us will think about is generalized social anxiety disorder. So, all those symptoms that Ali was talking about, they're present in most situations. So, most performance tasks and most social activities and gatherings that a person with social anxiety disorder has to engage in. The other type of social anxiety disorder is called non generalized or specific. And this basically occurs when the symptoms of social anxiety disorder for a person are only present in specific types of social situations. Um, some people, it may be only one type of performance, like public speaking. Um, and usually these symptoms are a bit less severe than generalized social anxiety disorder, just in their intensity and obviously because um, it's not pervasive to all social situations. But there are a wide variety of treatment options for social anxiety disorder and for people living with social anxiety disorder. Some of those options include psychotherapy, including cognitive behavioral therapy and more specifically exposure-based cognitive behavioral therapy, something that you may know as exposure therapy, which would involve gradual exposure to social situations which may cause intense fear in people with social anxiety disorder and gradually working up to a higher level of tolerance to those situations. Medications are also a really great option for people. You may find it interesting that the first line of medications for people with social anxiety disorder is actually antidepressants, um, which kind of goes back to what Ali was saying about the co occurrence of social anxiety disorder and major depressive disorder, um, and perhaps what that is kind of tying to in the biology of the brain. But anti anxiety medications and beta blockers that are used to inhibit epinephrine, which is a alertness neurotransmitter in your body, are also options. There are also many support groups that are available to people with social anxiety disorder and any other um, mental health condition. One specific one is NAMI Connections, which is a peer-led support group meant to connect people living with various mental health conditions and support, obviously, and facilitate growth. And more specific to social anxiety, there is a website called the Social Anxiety Support Chat, which may cater a bit more to the needs of a person with social anxiety disorder. It is an online chat, so it doesn't require face to face interaction, and it may be a good transitional route for someone with social anxiety disorder to getting the help that they need and the help that they deserve. Also, in a kind of more holistic sense, mindfulness and self care are always great for any person, but also people with mental health conditions, including social anxiety disorder. And there have been links to improvement of symptoms with exercise, good nutrition, healthy sleep hygiene, and of course, having a solid support system in your life. And so, for one more reflection question put out to all of you, we wanted to ask, what are some barriers to treatment for individuals with social anxiety disorder that you can think of? And by barriers to treatment, we mean things that might prevent someone or discourage someone from getting any of those treatments that we just talked about. Eunice says it could be difficult for individuals with social anxiety disorder to reach out for help. That's definitely a consideration. That's definitely something that does happen with social anxiety disorder, and of course, with a lot of other mental health conditions. And yeah, if you can't reach out for help to whether it's a medical professional or someone, a loved one, then it's really hard to get that help. Missy says getting help usually means having to make phone calls. That is a really great point. When someone is struggling with social anxiety disorder, a phone call may be this huge barrier. Um, and, that, I know a lot of us don't love making phone calls, but for someone with social anxiety disorder, that may be a massive obstacle. And absolutely, that could really discourage someone from getting treatment if they thought that to do so, they needed to put themselves in a social situation that would bring them really severe anxiety. Thank you to everyone who typed in the chat. And this will all kind of transition into what Christine will be talking about when it comes to advocacy and stigma.
Yeah, so now we're going to talk about the whole stigma issue around social anxiety disorder. So, first, we're going to talk about some common misconceptions. When you first talk about social anxiety disorder, one of the key personality sort of characteristics that comes to mind is introversion or shyness. And although this may be true with a person with social anxiety disorder, it's not necessarily 100% correct. So, a person with social anxiety disorder not naturally socially anxious, and so it's something more underlying psychologically. Additionally, it's also important to note that it's not only specific to situations such as public speaking, and it can happen in other aspects of life. For example, like Ali mentioned before, and some of the other discussion participants mentioned grabbing a coffee, something like that. So it's not it's not only limited to public speaking and can happen in other contexts. Additionally, people may think that it's analogous to other anxiety disorders, but in fact, this is not true. And so, to give a couple examples, there's generalized anxiety disorder, and what this might look like is, in a more broader sense, anxiety that's not limited to social context. And so, that's the main difference between social anxiety disorder and generalized anxiety disorder. And then another example would be agoraphobia, which is the avoidance of public areas in order not to feel trapped. Although this is situation specific, like social anxiety disorder, it's specific to a fear of being trapped as opposed to being judged. And so that's one of the key distinctions that we should be able to make. And so it's with those in mind, it's also important to note the cultural differences in how we see social anxiety disorder around the world. And so, just to give a couple examples, there's a diagnosis of social anxiety disorder called Taijin Kyosho. It's primarily found in Japan and the Korean peninsula, and it's this fear that others will be embarrassed or offended by physical presence, and it highlights this feeling of self inadequacy with peers, and so that's characteristic of this specific cultural difference. And I think it's interesting when we think about like how these cultures portray um, their customs. And so, for example, in Japan and Korea and Asian cultures in general, it's important to respect elders and be good enough for family, filial piety, things like that. And so, just thinking about those cultural aspects is interesting to think about how they manifest in things such as social anxiety disorder. The other example we wanted to talk about was I'm at Zibor, and this is present in ultra Orthodox Jewish communities, and it's the fear of speaking on religious matters publicly, and it's motivated by personal shame. And so this is really important to note that it's gender specific in males. What they've found is that as it has a higher percentage in males, they haven't done much more research on the percentage in females, so I'm not sure how accurate that would be. But with Jewish culture in general, it is often up to the males to speak on their religious matters, and so as this only is present in males, it's important to see how those cultural influence affects the social anxiety disorder presentation. The next two slides are going to be more about advice on how to assist and help someone or yourself with social anxiety disorder. So, to help yourself with social anxiety disorder, it's important to self educate and research on your diagnosis. And so, some questions to ask yourself is, how can social anxiety disorder affect my life? And what behaviors do I engage in that exacerbate this? So, really recognizing what certain behaviors, such as avoidance behaviors or derealization, can affect how you engage in social anxiety. Also, are there specific situations that make you especially anxious? So, maybe it not be public speaking, but maybe it be talking to friends or talking to new people. Um, and so, really recognizing those specific situations is important to understanding how this diagnosis affects your life personally. And also, self actualization is really important, paying attention to common symptoms of social anxiety disorder. And so, like I mentioned before, avoidance behaviors, derealization, etc. It's important to, once you realize your diagnosis, to expose yourself to these uncomfortable situations so that you realize that your thoughts aren't as extreme as they are in real life. And so, in many exposure therapies and such, they'll often implement role play of social situations, and eventually, this is in turn supposed to progress into real life social situations. And it's important to do this at your own pace so that you're not overwhelmed and discouraged from exposing yourself to these uncomfortable situations. Lastly, we've touched on this self diagnosis piece in our other presentations, but it's really important to not self diagnose before any professional care is sought. And so, avoid self diagnosis, and if possible, join social support groups. That can really help you see how social anxiety disorder affects other people in your community and how they're different or similar to your experience. Next slide, please. And so, to help someone else with social anxiety, again, it's important to educate yourself on the disorder and understand how that disorder can affect one's daily life or social circles and such. And so, another important thing to mention is setting boundaries, such as giving space and encouragement to the person with social anxiety, but also staying connected so that you're constantly checking in with them about their progress. And also, actively listening is really important, as their concerns would feel heard, and really understanding their perspective as to why they feel this way is really important. Also, avoid enabling old habits. So, this is really important to encourage to place themselves in those uncomfortable situations. So, for example, if in the past you've often spoke up for them and also introduced them to other people, it's time for them to do those activities themselves. And lastly, support groups are really important to understanding how it's like to live with people with social anxiety, or have a close friend or family member that also has social anxiety disorder. And lastly, it's important to help yourself before helping others. And so there's that aspect of self care is not selfish. And I think we've mentioned that before in the previous presentations. But yep, that's the note I kind of wanted to end on.
Great. And lastly, we wanted to talk just a little more directly about tackling stigma. So a lot of this will kind of be going over a lot of the stuff we've already talked about in previous presentations, but we thought it was important to reiterate. So first was being intentional about the mental health language we use. We always talk about the importance of mental health language because the language we use in our everyday life matters and may make a big difference in an individual's life and perception of mental health and mental health conditions, whether that's for themselves or for someone they know and love. And we all may slip up with this type of language, but what's important is taking accountability for those mistakes when they happen, learning and educating ourselves, and striving to do better. We also want to encourage help seeking behavior. We know that stigma can really discourage people from seeking help for a mental health condition that they are struggling with. But by encouraging open and accepting conversations about both mental health conditions and treatments like therapy and medication, we can encourage this help seeking behavior and help people with social anxiety disorder and any other mental condition get the help they need and deserve. And of course, listening to those with lived experience. No one knows a mental health condition better than a person living with it, though everyone will experience social anxiety disorder or any other illness differently and personal to themselves. But uplifting the voices of lived experience empowers people with mental health conditions to tell their truth and silence around mental illness and correct misconceptions. And lastly, spreading acceptance and correcting misinformation through social media or other networks is an important tool, and that's obviously what we hope to do through Pup Support. So, I'm really proud to be part of this organization and do the work that we do. Yeah, and here are our resources. There are links to those social anxiety support groups that we mentioned in the presentation, and they will be in the slides and the description of the YouTube video. Thanks, everyone.